This is Radio Health Journal. I'm Reed Pence. This week, rural hospitals in trouble.
There have been about 70 that have closed since 2010, and another 700 are qualified as being at risk of closure.
The economics of rural health when Radio Health Journal returns.
Good dietary practices have a strong connection to a lower risk of cognitive decline as we age, according to 4 large new studies reported at the 2017 Alzheimer's Association International Conference. Results of one study show a 35 to 40% lower risk of cognitive impairment among people who've consistently followed heart-healthy diets. Even modest improvements in diet bring a lower risk of decline. Dr. James Hendricks is Director of Global Science Initiatives at the Alzheimer's Association.
The size and length of these 4 studies clearly demonstrate how powerful healthful eating can be in maintaining brain health and function. However, what we eat is just one part of the puzzle. Studies show regular exercise and lifelong learning are also important to reduce the risk of cognitive decline.
Another of the new studies suggests that poor diet may promote premature signs of aging through inflammation. To learn more, including the Alzheimer's Association's 10 Ways to Love Your Brain, based on the latest research, visit alz.org.
About 14% of the nation's population call rural and small-town America home. The 46 million people there are served by about 2,200 hospitals, many with fewer than 50 beds. And around a third of those hospitals are in deep financial trouble.
There have been about 70 that have closed since 2010, and another 700 are qualified as being at risk of closure.
That's Dr. Carrie Henning-Smith, a research associate at the University of Minnesota Rural Health Research Center. She says there are a variety of reasons why rural hospitals are in danger.
One of the main reasons is obviously the fact that rural areas are older, poorer, and sicker on average than urban counterparts. And so rural hospitals are taking care of a more challenging population and often face financial pressures that make it difficult for them to stay open and stay viable. They're also facing some challenges when it comes to things like basic infrastructure, the buildings, the equipment, being able to afford to keep those up. When we think about telemedicine and all of the technology, including internet broadband technology that's going into providing health care, rural hospitals are at a disadvantage there. Rural hospitals also struggle quite a bit attracting, recruiting, and retaining a workforce. Rural areas have health workforce shortages across the board.
The biggest factor by far among those is the makeup of the population served, sicker, older, and poorer than those in urban areas. That means, first, that their health care is expensive. And even more importantly, it means that the primary payer for about 2/3 of all care in rural hospitals is the government through Medicare and Medicaid.
Rural hospitals in particular serve huge populations of Medicare recipients because rural areas are older than urban areas, and so just have more Medicare recipients. And Medicare payments tend to be a little bit lower than the actual cost of providing the services. And so because of that, we see many rural hospitals operating at a loss. In fact, some recent research shows that more than 40% of all rural hospitals are operating with a loss.
The mission of these small rural hospitals is to provide critical access points of care for rural beneficiaries. Very, very difficult to maintain that access as the margin shrinks and then goes negative. And only a few years ago, we were seeing about 35% of rural hospitals with negative margins. And in this year's study, we noted 41% of those rural hospitals are operating at negative margins.
Michael Topchick is director of the Chartist Center for Rural Health.
They're not trying to, get rich quick on Medicaid. And indeed, the payments offered by Medicaid are very small on a percentage basis compared to Medicare. And Medicare is not exactly a payer of choice either, although it is a more solid revenue stream than Medicaid. It's really the commercial payment that is how most providers kind of make up the difference. That's how they tend to close their gap. When 2/3 of your payments come from government, it's very difficult to make it up. The old joke that you can't make it up on volume if the payments are losing money.
Topchick says the situation could get much worse if Medicaid cuts were to take place, as have been included in congressional proposals to repeal or replace Obamacare. The White House has made it clear that it won't take no for an answer, but ending the Affordable Care Act would eliminate benefits for about 15 million Medicaid recipients in the first year alone. Henning Smith says the national health will suffer as well as rural hospitals because without Medicaid, millions of people put off the care that they need.
What we tend to see is that people aren't getting their preventive health care. They don't have a usual source of care. They're not getting primary care visits. But often people still do need care, especially in emergency situations. And so then, unfortunately, we see people relying on the local emergency room in dire situations.
Imagine a diabetic or any other patient who has some sort of chronic disease that needs regular maintenance, regular pharmaceutical care, and if they can't get good access to that type of therapy, they're going to wind up in an acute situation in our hospitals receiving care that is far more expensive, and of course, there's no ability then for them to pay for that. And so the hospital has to absorb those costs. One way hospitals have to then manage that increased burden of costs that aren't being reimbursed is by raising their rates and charging all of the rest of us to support that care.
However, hospitals can only shift costs so far. Dr. Daniel Dirksen is a family physician and director of the University of Arizona Center for Rural Health.
I think what a lot of Americans don't quite understand yet is that older Americans, elderly, and the disabled only account for about 1 in 4 Medicaid enrollees. They account for about 62%, 63% of the costs.
And while 1/4 of Medicaid recipients are elderly, Dirksen says, another half of them are children.
I think Medicaid is an issue. We certainly have to do innovative things to reduce the rate of growth of expenditures in our publicly sponsored programs. But I don't think the answer is removing 14 million people from Medicaid enrollment and cutting $1 trillion over the next 10 years to state Medicaid programs. That's the federal share of that. It's almost a 25% reduction over the next 10 years of state Medicaid funding from the federal government. No state can absorb those types of losses.
It really would be devastating to the rural health safety net. These types of cuts would be unlike anything we've seen in a generation or more. I think it is virtually the dismantling of the Medicaid program. We have seen 80 rural hospitals close since 2010, and our analysis shows that this would push more rural hospitals into the red. It's very difficult to know how many of those could weather these types of cuts, but I think our best thought is that it would accelerate the rural hospital closures.
We may already have a good look at what might happen by seeing what's gone on in the 19 states that didn't expand Medicaid under the Affordable Care Act.
The research shows that about 2/3 of the hospitals that are at risk of closure are in those states that did not expand Medicaid. We see higher rates of uninsurance for obvious reasons, and a lot of rural hospitals are then providing care to people who have no insurance whatsoever, and they're providing that care at a loss, or they're having to eat the cost of providing that care. Had those states expanded Medicaid, some of those individuals would have been eligible for Medicaid, and then at least the rural hospital would get some coverage through Medicaid and some cost reimbursement through Medicaid. Right now, they don't get any at all for the uninsured patients.
And if rural hospitals close, the effects could be far-reaching for patients and for their communities.
And a rural hospital can really be the hub of making sure that you have an adequate health system. Critical access hospital is a federal designation, and those are the really small hospitals in rural areas that are 25 beds or less and 35 miles or more from another health facility. And in our most rural and even the frontier areas of our country, they tend to be critical to serve the catchment area, the population that lives within 100 square miles or so of those facilities. So it's very concerning because we just don't see, once a rural hospital goes under and closes its doors, we don't see them pop back up. They tend to be permanently closed.
The most obvious repercussion is the diminished access to care. If you have one local hospital in your county or multi-county area and that closes, you have to go a lot farther to get hospital level care. And that's especially important when you're thinking about emergency situations. If someone has a heart attack and needs to get to the hospital in a life or death situation, it makes a big difference whether they have to go 10 miles or 60 miles. So that's the most obvious repercussion. But the other one that's really important is the economic implications for the community itself.
An analysis by the Chartist Center for Rural Health shows how important rural hospitals are as economic engines. If Medicaid cuts were to go through, as envisioned in Repeal and Replace, it would bring a loss of about 35,000 jobs nationwide and around a $4 billion drag on the nation's gross domestic product.
There has been a lot of really compelling and good research showing that if a hospital closes, the economic repercussions for the town are pretty drastic. The town is going to lose some of the tax base of the workforce that was there. They're going to lose that sense of community vitality. Sometimes hospitals are the biggest employer in town, and when you close the town, you shut down jobs for people. You're going to make a big difference for the town. You're going to lose a lot of people and a lot of economic health.
These tend to be good, high-paying jobs amongst the most stable and most high-paying jobs that you'll see in a rural community. Education would be another one of those sources of high-paying jobs. The World Bank does some great work in creating ratios to look at the impact of every one of those dollars spent in terms of the GDP. And so this is a big driver for the rural economy. The multiplier effect of every dollar spent in healthcare that provides salary to one of these folks who then requires services in their community, maybe goes to a restaurant, buys a piece of machinery, et cetera, et cetera. Very, very difficult for any type of business to open up or relocate in a rural community if there's not access to health care for their employees. So we see a multiplying effect in the extreme when hospitals close.
You can find out more about all of our guests through links on our website, radiohealthjournal.net. You can also find archives of our programs there, as well as on iTunes and Stitcher. I'm Reed Pence.
Radio Health Journal returns with medical notes in just a moment.
Summer vacations are a welcome disruption to our routines, but they're not the time for heart attack survivors to take a vacation from their medications. Did you know that after one heart attack, patients have a higher risk for another? Dr. Warren J. Wexelman, cardiologist at the NYU School of Medicine, says patients can help reduce their ongoing risk by asking their doctors about treatment options and how a 90-day prescription may help with adherence.
After a heart attack, there are several medications you may be prescribed to reduce your risk of another one. However, one study showed rates of adherence were as low as 63% after 3 months. Non-adherence is a serious issue. It's crucial patients take medicines as prescribed to optimize their treatment. One tip to maintain your treatment routine is to ask your doctor about a 90-day medication supply, which one study showed improved adherence by 20% versus those requiring refills every 30 days.
When considering treatment options for you, be sure to ask your doctor about Brilinta ticagrelor 90 mg tablets, a prescription for adults who have been hospitalized for a heart attack, also known as acute coronary syndrome. Brilinta is used to lower your chance of having another heart attack or dying from one. Take Brilinta twice daily with low-dose aspirin once daily. Don't take aspirin higher than 100 milligrams daily, as this affects how well Brilinta works. Don't stop taking Brilinta without talking to your doctor, since stopping it too soon increases your risk of clots in your stent, heart attack, stroke, and even death. Brilinta may cause bruising or bleeding more easily, or serious, sometimes fatal bleeding. Don't take Brilinta if you have bleeding like stomach ulcers, a history of bleeding in the brain, or severe liver problems. Slow heart rhythm has been reported. Tell your doctor about bleeding, new or unexpected shortness of breath, any planned surgery, and all medicines you take. For more information, see our ad in Weight Watchers magazine, visit Brilinta.com, or call 1-800-BRILINTA. If you can't afford your medication, AstraZeneca may be able to help. This summer, ask your doctor about an effective medication that can help protect you from having another heart attack. Don't forget to ask for a 90-day prescription to help you avoid a medication vacation.
Medical notes this week. The fertility of men in the Western world is declining. A new study in the journal Human Reproduction Update finds that the sperm count of men in North America, Europe, and Australia has dropped by an average of more than 50% in the past 40 years. However, fertility has not declined among men in Asia, South America, and Africa. Researchers have only theories as to why it's occurring, but the trend is worrisome because low sperm counts are linked to poor overall health. Is the inability to taste food a cause of obesity? A new study shows that people who can't taste food very well are likely to choose sweeter, higher-calorie foods to make up for it, and that puts them at risk of gaining weight. Researchers writing in the journal Appetite temporarily dulled the taste buds of a group of research subjects and allowed them to add as much sugar as they wanted to a variety of bland foods. People with poorly functioning taste buds added about a teaspoon more sugar, on average, than those in a control group. And finally, if you want to memorize something, learn it, then have a drink. A study in the journal Scientific Reports that's likely to raise eyebrows shows that alcohol improves the recall of something learned just before drinking. In fact, the effect appears to be enhanced by drinking more. Scientists had two groups learn a group of words, then take a test of their recall. After the test, one group was instructed to go out drinking. The next morning, those in the drinking group remembered even more than they had right after they had learned it. And that's Medical Notes this week. More in a moment.
Car seats protect our kids, but they only work when installed properly. Don't leave your child's safety to chance. Hi, I'm Debbie Hersman, president of the National Safety Council, and this is your Safety Minute. 73% of car seats are not installed or used properly, which can put your child at risk. On average, 2 child passengers under 13 die every day. So remember to choose a car seat to match your child's height and weight, not just their age. And after installing your car seat, tug on it from the bottom. If it moves more than an inch in any direction, it's not installed correctly. A properly installed child seat can reduce their risk of death by 70%. For proper installation, check your car and seat manuals or visit your local police or fire department.
Safety Minute is brought to you by the National Safety Council and the Volkswagen Group of America.
Thank you for listening to Radio Health Journal, a production of MediaTrax Communications. If you enjoyed this week's show, please leave a review on iTunes or share it with a friend. You can find more Radio Health Journal stories about health, science, and technology on iTunes, Stitcher, and at radiohealthjournal.net.